Hello, everyone. Welcome to another episode with Nurse Amy on Nurse Amy Academy. So today, we are going to talk about some of your skills. Okay, one of the important ones is let me see. No, well, one of them because there are two. Is it two? We have emptying a drainage bag. Okay, and then we have bedpan. Those are the two. Oh, drainage bag, yes. Drainage bag, at least in the state that I teach in, drainage bag and bedpan. Those are the two urine where you're going to be working with urine. Okay. How many of you know how to end this skill? Okay. Yeah. If you're dealing with urine, and I've talked about this before, if you're dealing with urine, that's part of the hand washing. I told you guys anything to do with the genital area and urine, you are going to do hand washing, okay? And anything to do with the mouth or the mouth area, that is PPE. So please try and remember that. So let's talk about the urine. I want to talk about urine because it's one of the questions I got. How important is recording urine? Okay. And I think I talked about it in my book. 7 tips on how to prepare for your CNA, your state CNA exam. Okay, you got to know your skills. You have got to know your skills. You have got to know your skills in the state you're going to be tested on. If you're going to be tested in California, it's not the same way they're going to test in Indiana. It's not the same way they're going to test in Maryland. It's not the same way they're going to test in Ohio. So you need to know what is required from your state exam. So you need to know going into the testing site. You need to know. So boom, you already have that. The other thing is a lot of these places will test you on Europe. Why? Because as part of the job you're going to be doing, that's part of the ADLs. Okay, that is the bane of your job. As a CNA, you're going to be assisting people in activities of daily living. And like this is the way I teach. I don't try to get you to memorize the different activities of daily living. How can you do that? I think that you can't do that. Like, okay, we need to do this. Washing is one of them. What's the other one? Oh, they go to the bathroom. No, what I tell my students, and I hope you do take that and remember this. I'm going to give it to you again. Think of what you do every day. That is the activities of daily living. Everything you do each day. Do you go to the bathroom? Bing. Do you comb your hair? Bam. Do you brush your teeth? Bam. Do you have a bowel movement? Hello. Do you eat? Do you dress? Do you talk on the phone? Do you see how it works? So do not overthink it. Because I have people saying, I can remember the activities of daily living. What do you do every day? So I just wanted to quickly put that in. Maybe I'll do another video of that by itself. But how important is the urine? Well, I do talk about this in my red book. Actually, it's red. Yes, I'm gonna put the link down so you can get a sense for it, and go ahead, purchase it. You can get the ebook, you can get the physical paperback, because some people I like the feel of a book. Okay, I have ebooks, but I also like the feel of a book because I'm a writer, and it will help you. I can tell you it has helped a lot of my students. So go ahead and get that book, and you can also gift it to a colleague or a son, a daughter, or someone that you think is going to help. And in this book, I did talk about no matter how great you are, you're polite, you smile, you dress right, you smell right, your hair's up, you are, you're professional. If you don't know your skill, what do you want them to do? Seriously, it's the same thing when I'm in class, okay? You're doing everything, you're confident, you're professional. I'm just rooting for you. I want you to pass. I'm in love with you. And then you go to do a skill that has you doing a recording, because part of that skill, it says to record. It also says that me as the nurse, or if you're testing, the nurse, the RN test observer has to measure, because part of testing you is how well you are able to measure or to read or to interpret the recordings, right? So if you don't do it, I cannot give you credit for it. So it impedes or it stops the cheering for you, right? So that's how important it is. If you do not do the recording, if you don't record the urine, you failed. So if you did bedpan and you did not record the urine, you failed. If you did emptying a drainage bag and you did not record the urine, you failed. Okay? Because it carries such a big weight. Okay? Why not? Because it is part of your test. Part of your test is trying to evaluate how well you can interpret the recordings, how you can measure. I have students in class saying, and especially for those who do work outside in the community, they're like, yeah, but we don't record urines. Yeah, but then you're not being tested at work, right? So, however, if you needed to record it, well, you need to be able to show that you can. Does that make sense? So, and for those who don't know, they're like, oh, because I've been asked both ways, do we record urine all the time? No, you do not record urine all the time, but you need to be able to show that you can. Okay? I mean, it's like me being a nurse. Do I, every patient that I see, do I give them a shot? No. But then I need to be able to give shots. I need to be able to show that I'm able to give shots. Just in case an order comes and says, okay, give whatever cc of somebody IM SQ or intradermal, whatever it is. I need to be able to read, to interpret it, and to be able to give the right dosage. And that's why I'm being tested in pharmacology, in dosage exams, to show that just in the event that you need to do this thing, you can do it. So it's the same thing. So it's not enough to say, well, because I've had someone in class say, oh, don't worry about it. You're not going to be doing that at work anyway. You don't record urine. Of course, I had to check that person. I'm like, don't say that to my class. Okay, just because you're not going to be doing it doesn't mean you shouldn't know how to do it. Because there are times when part of your duties is going to be like, okay, we need the INO on this person. So we need to, everything coming out, the urine, you're going to measure it. Sometimes even the poop, okay? So please understand that. It is very, very important. You need to learn how to measure, how to read the graduate, okay? So for, I'm not probably going to do that now. I might just do another video to tell you how to read. You have to know. You're going to be tested on it. So no matter how great you are, no matter how polite, no matter how confident, and I've seen it happen in my class. And that's why I wrote this book, where I'm rooting for you. Everything is fine. Everything checks. Hair pulled up nice. Earrings, no loopy earrings. Again, I covered all this in my book. I teach you. If you follow my book, the red book, okay, if you follow that to a T, I can promise you, in addition with knowing your skills, that's why I'm still teaching skills, there's no way you can't pass. Okay, so like I said, it's happening in class where everything just check, but then it comes to the urine and they just pour it, no recording, nothing. I have nothing to go with. And I'm like, you did so well until the urine part. What am I supposed to? It says so in your book. Make sure you're not, and they give you a range or parameter saying, okay, it shouldn't be more than 25 cc reading of the RN test observer. That means something. So that means you're being tested. So how do I know what you got? So you tell me, oh, I got 500 cc. What does that mean to me? How do I know you got 500 cc? Do you see? Does that make sense? So again, I hope this, you kind of understand this, because it's so important. I keep telling everyone, please, you need to record the urine. You have to record it. It's not enough for you to record it in your brain. I can't read your brain. There's a way I even teach it. I tell because I teach you to pass. So maybe another video, I might just come back. If you guys want me to do that, okay, DM me, write to me. If you want me to walk you through the steps on how to do this, I might just do it, please, because I want you to pass. You don't want to waste time, not just giving points away. Okay, hopefully this video helps you, and if it did, give me thumbs up, because that really helps me too, right? So we're helping each other. And yeah, please record the urine. I'll see you in my next video.